Hello everyone, welcome to our channel Small World Aussie. My name is Megha. Today I want to share with you my experience of working as an AIN in a COVID ward. Initially, I was working in a rehabilitation ward, but once COVID hit, our ward was converted into a COVID ward. I have to say that it is my positive outlook in life which helped me manage the stress of working in a COVID ward. As an AIN, I mostly work the morning and afternoon shift. So, for today, I will focus more on the morning shift. In the public hospital where I am working, the morning shift begins at 7 in the morning and finishes by 3:30 in the afternoon. Handing over takes place anytime after 7 by 7:10 or 7:15, and it is crucial that you are on time and you do not keep the night team waiting. During the handing over from the night nurses, you get an overall picture about your patient. You understand how alert they are, or whether they are aggressive or confused, how they mobilize. Some patients are independent and self-caring, but others might be mobilizing using a four-wheel walker or a walking stick. So it is really important to be on time for handing over, and you do not want to go into a room without knowing anything about your patient. My next step is to complete a morning schedule for my patients. I have been working in a COVID ward for around 3 months now, so I make my own schedule. If you are somebody new to the ward, then your EN or RN will help you to make a schedule. A morning schedule looks something of this sort. You have the bed numbers on one end and the time on the other. In a COVID ward, we have to take observations twice in a shift. So in the morning shift, I usually take the observations at 8 a.m. in the morning, then again at 12 p.m. in the afternoon. So in my morning schedule, I will have the observations to be taken for the patients. Sometimes some patients require their BGLs to be taken. Some patients will require pad change. I prioritize and I make my own schedule. In case you are somebody who's very new to the ward, do not worry. Your EN or RN will help you to make a schedule. Before I go into my patient's room, I see whether the PPE is in stock outside the room. I get their patient's breakfast tray ready, and I also get the fully charged OBS machine with me before I enter the patient's room. Now, this way, I am maximizing the use of PPE and minimizing the need to go into the patient's room again and again. Once I am inside the patient's room, I explain to them who I am and what I am going to do. And once I have their consent, I will help them sit up for breakfast, as some patients need help with their breakfast tray. Sometimes they need help with feeding. Other patients can be independent and self-caring. So for every patient, I do their observations, and if their bed requires tidying up, if their table requires tidying up, I do minimal tidying up. After I complete taking observations for all my patients in the morning, I enter all these details in an online database. Once I have completed that, it is time for morning break. But there have been situations or days where I have not been able to take a morning break because the ward is really busy. In that case, I take a longer lunch break. Once I have my morning tea break, it is time to start the second round of my observations on all my patients. This time when I go into my patient's room with all the PPE on, I remember to take their towels so that my patients can have a shower themselves. Some of my patients have to be given a shower or even a bed bath. And then I complete another set of OBS on them. I check the sharps container, whether it is full, and if it is full, I take it out because another new one has to be kept in its place. I do a BGL, a blood glucose level test, on my patient, whoever requires one. Again, after the whole set of observations are completed for all my patients, I enter it again in an online database. Now it is time for lunch. Once I have my lunch, it is time to do Waterloo assessments false risk assessments, bowel charts for all my patients. So anybody who's listening to me can feel that, oh, this is all right, this is quite planned, everything is going according to a plan, this is quite easy. But to be honest, there a lot of unplanned and unexpected things happen when you're working on a ward. For example, you can have wandering patients, you can have confused patients, you can have an aggressive patient, or you can have just patients who refuse to work with you, who refuse to have their observations taken. You can have an OBS machine, a faulty OBS machine which gives you out of the world readings and you are stuck wondering what's happening here. You can have medical emergencies on the ward. There is so many things that can go wrong, like for example, staff can mix up patient's meal, the shops bin can be full, there is a shortage of PPE on the ward, and in really really unfortunate events, which this has happened to me, a patient can die. Which is really hard to handle mentally. This is really hard, but things happen, so we have to be ready for anything and everything. Keeping all the stress of working on a COVID ward apart, I would still say that I am quite passionate about working as an AIN, helping others when they are in their most vulnerable state. And I enjoy helping and working in a ward. If you are somebody who's a fresh AIN who's looking out for a job, good luck to you. I hope you enjoy your work, and I hope you have gained some information about what it is to work in a COVID ward. Uh, Hopefully we can meet in another video. Thank you. We have to be really, really, we have to really, we go